This is Christopher Jones, and this is a video performing an all-inside ACL reconstruction. So this starts after I've already cleaned out the residual ACL. That was the PCL that was to the left, and you can still see it a little bit to the left there, left lower part of the picture. Now we're looking at some of the remnant fibers of the ACL. This is the very back of the femur where the fibers are hanging off the back of what we call the notch, and then there are some residual fibers on what is referred to as the medial wall of the lateral femoral condyle. Kind of see these fibers pretty clearly here. I'm putting a probe in, and what I'm doing is I'm kind of feeling the back of the femur because you really want to make sure that you're all the way in the back and right at the native footprint of the ACL and the femur. So what I'm actually doing right now, there's a guide that I use to actually put my guide pin in, which is also my drilling device. And all this is kind of going on outside the knee. That's why it takes a little time, but I'm working it into the joint right now. Sometimes the tissues, as you put them through the little small incisions, can cause the guide to get a little hung up. So you'll see the guide come in here to the right of the picture, lower part of the picture, kind of backing out so I can see the guide, deliver it into the area of the ACL footprint where we want the guide pin to come out. And this is where we're going to be drilling our socket. So also right now I got the guide seated, and the pin will come out right in that little notch. On the outside of the knee, I'm actually putting the second half of the guide in, and you actually have to first seat it up against the skin and make a small little incision of a few millimeters so you can slide the guide sleeve all the way down to the bone. Once we get that in place, we actually tap it in, and there's a little small cylinder at the tip that we actually impact into the bone to have a nice stable guide. So that's what's going on right now. It takes a little bit of time. Once we get that in place, then we're drilling our guide pin. You'll see that come into the view here in the next couple seconds. So this is the pin. Again, this is also called a flip cutter. You can see we'll tap it in just enough, and then we flip the tip of this, and this actually acts as our drill too, and it's a retrograde or reverse drilling, so we can drill just a socket, not have to drill a hole all the way through. So this pin is about 3 millimeters or 3.5 millimeters. So we flip the tip, and then that locks into place. And this is hooked up to a power drill. We didn't think it was it has to be fully engaged, so we got to get that line past the bone so that we can fully engage that. And then once we are happy with the position, we'll start the drill, and then we'll start making our socket. Again, there's several things going on the outside of the joint here, but here goes the drill. See, as it starts to spin, it starts to cut the bone. You can see our socket appearing. All this fluffy stuff you see is the bone debris from the actual drill. So usually we drill back to a depth of about 30 millimeters, and that creates the socket that we're going to pass the new ACL into in order to fix it to the bone. So once we do that, then we actually pass what we call a fiber stick through the guide, and you'll see I'm reaching in to grab this fiber stick here in a few minutes. Actually, this is a shaver. I'm actually debriding, taking away some of this debris. You want to obviously get as much of this out of the knee as possible. And you also want a pretty clear path for the graft to pass. So once we're happy that we've cleaned that out enough, we pass the fiber stick And there's a little small red tube that you pass the fiber stick through. And what this is a heavy strength suture. And we pull that through, and there's a loop end that we're pulling through, and we basically use this to pull the ACL, or pull the new ACL into place, and you'll see that here in a few minutes. So once we get that passed, we actually snap that on the outside to keep it in place. Right here what I'm doing is I'm actually dilating the other entry site. I got to make sure that the skin incision is big enough for the graft to pass through. And then once we're happy, we put the guide for the tibial side, or the lower leg bone. Again, similar process here. We put this into place, and now we're basically assembling the outer portion of this guide on the outside of the knee, and this is what our guide pin, aka flip cutter, will pass through. Again, these are very precise, so this pin will come out right in the center of that hole, and there's little hash marks which kind of help orient where we want to put it. And there's several anatomical landmarks in the knee. Most notably is the posterior cruciate ligament, which is right behind the pin that just came through, and then the front part of the lateral meniscus, which is to the right. So same thing here is on the femur. Got the flip cutter in place. We have to pass it in far enough that we can flip it. I was just seating that sheath on the outside as I did on the femur. Now I turn this just a little bit so that we have a clear path for flipping that and getting it fully engaged. All these fibers that you see that are sticking up around that pin were the residual ACL fibers. So we're drilling a socket in reverse. Again, we try to go to a depth of about 30 millimeters or so, or 3 centimeters. Once we do that, we bring the pin back in, we disengage it, and then remove that pin. So again, I'm coming in here with the shaver from the left here, again to clean up some of this debris. All this residual ACL needs to be removed so that it doesn't cause scar tissue. Before we drill our socket, we want that ACL remnants to be there because they help us in terms of guiding where we're going to put the tunnel, in addition to those other anatomic landmarks. So once again, I'm passing a fiber stick through, which you can see in this suture. It's actually called a tiger stick. It's the white with the black stripe, and having a different color actually is important. It helps differentiate what you're looking at when you get into the joint. And it can be a little disorienting. You want to make sure that, that when you pull this one out, you also want to grab the blue one, and they're coming out the same, what we call portal or entry site. And there's actually a technique here. You want the blue stitch on top and the tiger stitch on the bottom so they don't become entangled when you're doing this inside the joint. These are actually crucial steps to make sure that the graft will pass without any problems. So now what we're doing actually is we're feeding the sutures of the graft into the blue stitch. And you'll see here we're going to start pulling the blue stitch here in a second, and you'll see a white stitch appear right there, the upper portion of the and that's a titanium button. It's at the very top of the screen. That's what we're actually going to pull through and flip on the other side of the femur in order to get fixation. So we got those sutures pulled in. What I do is I kind of pull it. Oh, there's the button there. So we're pulling that through into the tunnel. Again, we pull it all the way through the femur until it's just on the outside of the femur. And there's the graft. You can actually see the graft coming into play right there. So you kind of have to maneuver this back and forth a little bit to actually make sure you're seated. Once we feel like we're close to being seated, then we use fluoroscopy or intraoperative x-ray to see the pin to make sure, because again we're doing this through a little tiny stab incision. You can't feel that that button is flipped. So right now I'm kind of maneuvering it. You can see the x-ray screen on the left, a tiny button up on the top right of the femur. And then there it flips down. So once we're happy, then we go back to the knee or back into the arthroscopic portion of the case, and we start delivering the graft into the tunnel with the Arthrex tightrope device. So as we're cinching down the tightrope, it tightens on itself, and we seat this ACL graft to a depth of 20 millimeters, which is the blue mark on the graft. Okay, so once we're seated and we're happy where we're at, we look down at the tibial tunnel or socket, which you can see with the tiger stitch. And again, we want to make sure that the suture is underneath the graft, and that's why I'm giving that a little tug. And then once we are happy with that, then I load the sutures on the graft through this loop of suture, and I pull that suture and deliver those sutures through the tibial socket and then out the tibial cortex. And once we get there, then again I just confirm that there's no tangles, and then I start pulling some gentle traction on the tibial end of the graft. Again, all this is going on outside the joint right now. And in just a second here, again, we're giving it a little traction. You'll see the graft, the picture kind of start to close down a little bit, and that's because the graft is getting pulled into the joint. And then the graft will basically get pulled down into this socket. So you can see it coming right now. And then the graft will, boom, be seated into the socket. I got a little debris floating here, so I'm going to come in with a forceps, or we call a little arthroscopic grabber. I'm going to grab that little piece and pull it out just because I don't want that in there to cause problems later on. Then once we're happy with our graft position, then we load a second titanium button. This is called an ABS button that on the tibial side, and we cinch that down with the tightrope device. And again, that's a self-tightening suture. And then once you're happy, you kind of toggle it back and forth, tighten the top end of the femoral end and the tibial end until we're happy with our tension. And I got a little probe or a little hook passed in the joint, and I'm feeling the graft to make sure it's nice and tight. You can see that the graft is actually made up of 4 different bundles because we take that hamstring tendon, we fold it over 4 times on itself. So that's our final graft. We take the knee through a range of motion, which you can see here, just to make sure that the graft is moving freely and there's no impingement. We take the knee out to extension, and that all looks good. So that was all inside ACL reconstruction. I hope you enjoyed that. Thanks.